The Ministry of Health, working with partners, considers continuous quality improvement as the foundation of all healthcare service interventions in the country. For a while, there was no systematic monitoring of QI performance at subnational levels.
We have been using paper-based reporting from the frontline workers to report QIs through the systems to the facility itself, to the districts, to the region, and to the national level, and also to the partners. We have had a lot of gaps in reporting, but more importantly also to follow up and support them based on what is being done.
In 2019, Makerere University School of Public Health METS program was requested by the Ministry of Health to develop an integrated CQI database to track all the CQI interventions and projects at all levels of implementation.
So what's happened in the last couple of years, METS came in and supported the Ministry of Health to streamline these processes, brought all these implementers and stakeholders together to agree on a unified way forward in terms of quality improvement. So we now have a very harmonized system for continuous quality improvement, and accompanying that, we have developed a database which was launched last year in November at a QI, the last Quality Improvement Conference, and this is what we are commissioning today.
The continuous quality improvement database is a technological platform which is going to help the Ministry of Health to have a central repository of all innovate, and this is done through the various quality improvement projects they implement to improve maternal health, to improve retention and care, improve viral load suppression and adherence to treatment. So this innovation is going to help the ministry aggregate these learnings because they test changes, the changes which work, they document that this worked or didn't work.
And I must say that in the development of this QI database, we actually had a partner, the Health Information Systems Program, commonly known as HISP. And they actually provided us with their input from their different software developers who teamed up with our brilliant minds at METS, and we have a system.
This database is going to make it much easier for us to know what is being generated at and what level, and how we can use it to do the monitoring, to do the supervision, and to identify the gaps where we need to do capacity building and the like.
As the Kabale Regional Referral Hospital, our region is the Kigezi region, and we have a number of indicators and the QI projects that we are currently following. It has helped us significantly in reviewing the processes and the outcomes of the data that we generate, but it has also helped us to provide feedback to the clinicians and managers within the facility.
There is flexibility how much different facilities can also access data from other sources for the purposes of learning. Say, if we are dealing with this, how have these other people done it?
Come with support supervision strategy in place. We shall continue with support supervision to identify the areas of strength and the areas of weakness that need to be supported and strengthened.
As METS will continue to support some capacity building efforts through their implementing partners, we think this knowledge that is being passed on and cascaded to the lower levels is a great instrument in terms of sustainability, because once one knows something and appreciates its use, they will continue to plan for it because it will be relevant to the program.